Hi, hello, welcome to another episode. Today we're going to talk about exacerbations and triggers. So basically those things that cause you to feel like you're not breathing as well as normal. And so we're going to kind of get into that a little bit more. So, and as Dory remembers, just keep breathing, just keep breathing. Da, 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 da. All right, so what is an exacerbation? An exacerbation is anything that causes a worsening of your normal day-to-day conditioning. So it usually results in a change in direct therapy. A lot of times exacerbations result in another hospitalization. So our goal is to try to prevent that. We really want to limit your exacerbations and keep you out of the hospital as much as possible. A lot of times you'll see an increase in prednisone prescribed. So what is a trigger? Triggers an exacerbation. Anything that can cause increased wheezing, increased coughing, increased nasal congestion, and a shortness of breath. And then long-term exposure to them can lead more to exacerbations. And so controlling airborne things are going to be very important. So you can see here, this one, our airways are nice and open before we get into and we get exposed to a trigger. And then within 10 minutes of that change, look, we have lost that nice, neat, pretty clean airway. So that is why you feel that wheezing, why you feel that congestion whenever you are exposed to some sort of trigger. All right. So what can they do to your lungs? Well, anybody that suffers a number of exacerbations can end up seeing a decrease in lung function, can see an increase in disease progression, and a permanent decline in that quality of health. So continuous exacerbations, one after another, can continue to lead to decreased function, decreased feelings, and like we talked about before, that overall quality of life. So it decreases that quality of health and how you feel overall. So, like this picture. Hello, Paula, my old friend. It's yellow again in North Carolina. Luckily, it is starting to taper off. But exacerbations are usually caused by bacterial infections, so something that you picked up from the environment. Can be caused by air pollution, so that is going to be things that are floating in the air all around you, whether it's pollen or increased pollution in general. So those people that live in high industrial cities that have a lot of increased pollution, they're going to see it a lot more. Reflux. So if you don't control your reflux, you can actually cause a lot of damage to that esophageal area. Cold weather. So we always tell you guys not to go out in extremely cold temperatures, and it's because your blood vessels are constricted, and it makes it harder to breathe because those blood vessels in your lungs are constricted as well. And then sometimes you can have a bad effect to some of your medications. So that's why it's really important that you continue to have this interaction with your physician so that you are able to manage those medications completely. A compliance, especially with your inhaler, can reduce exacerbations by 22 to 26%. That's huge. If you're not using it the way that you should or the way that it's been prescribed, you're actually not getting your medication the way you would. It's just like taking your antibiotics and say, oh, I'm feeling better, so I'm not going to use it today. It's the same thing. So if you're prescribed a daily inhaler or a daily nebulizer, it's important that you continue to use those daily because they keep those airways open. All right, so don't wait. If you think you have an infection, you think you're sick, go ahead and call. Don't wait more than 24 hours to call. Call immediately. If you notice something's different, you know when your breathing's off. The maximum waiting period is 2 days. So if you're like, okay, maybe I just didn't sleep well last night, or, I know the pollen's really bad today, something's going on, then you can wait, but don't wait more than 24 hours, 48 hours at max. Waiting any longer will just make it less effective, and it's going to take you that much longer to recover. So we want you to get in, get seen as soon as possible. So now we're going to talk about some of the different kinds of triggers. So this is a lovely picture. So you have mold, which is very dangerous. A lot of times you see mold in the ceiling setting. It can get in behind your walls. It can get in the bathroom with mildew. Mold is very dangerous, and it's often the most expensive to take care of if it develops. And a lot of times you can have mold and not even know about it. So that's very important to kind of keep an eye on that. Pet dander. So this is Flynn's lovely picture up here. It's Joe's dog. So pets shed. It's just what they do. Even if you have a hyperallergenic pet, they're going to shed. So dogs, cats, anything with fur, guinea pigs, little ones, birds, all have different kinds of dander that they'll leave behind. I've had a short hair and a long haired dog, and I pick up a small mammal every time we vacuum or clean up. Then you can have insects. So the top picture here is your cockroaches. The middle picture is a dust mite, which is absolutely disgusting. These are going to cause a lot of triggers. So the dust mite, the cockroaches, you kind of know where to find those. They're indestructible, I do believe. They'll still be here when we're all gone. And then you've got dust mites. Those dust mites are going to get in your material. So this is why you want to put a protector on your mattress. Use a pillowcase, because that's where they're going to tend to live. They get in places where that collect dust that aren't cleaned very easily, so your couch cushions, your stuff like that. So it's just important that you make sure you clean that stuff routinely. Use a protector on your mattress pad so that you're protecting yourself. And then the environmental triggers. So that's going to be your pollen. It's going to be that air pollution, everything like that. We actually had one lady come through the program, and one of her triggers was smoke. And honestly, for me, smoke is a trigger. So she was driving in her car, and she was actually enjoying a beautiful day, and she had her windows down. And she came around the turn, and she saw the smoke across the road because somebody was burning leaves. And she didn't have time. She got the windows up, but she didn't have time to get the windows up and switch the car over to interior air quick enough, and she ended up driving through the smoke, and it pulled it into the car. And about 2 hours later, when she got home, she could still feel the effects, and from there it just continued to get worse, and she ended up having an exacerbation from driving through just a small field of smoke. And it was something so small and so simple, but it was enough to cause her to have an exacerbation. Luckily, she caught it early enough and was just able to go on prednisone and didn't have to get hospitalized. But even small things out in the world are big enough to cause triggers for us. So outdoor triggers is kind of what we were just talking about. So you got trees, grasses, ragweed. Those are all wonderful pollens that we're going to see, and they drop stuff for us all the time. So when you have seasonal allergies, this is oftentimes the ones that you're going to see. So trees and grasses tend to be early spring to early summer, and then that ragweed tends to pick up about late summer, early fall. So if you do have seasonal allergies, that's kind of where they're going to come in. The air quality. So you're talking about ozone, and so that's going to be where you're looking at, you want to get on the weather websites and check out what the air quality is. Ideally, we stay in the green. Oftentimes around here, we don't usually get worse than a yellow. On occasion, we do reach up to an orange. And then the next level would be red. So if it's green, you're fine to do whatever you want. If it's yellow, you don't want to go outside and exercise those days. So you want to make sure you're staying in a nice controlled environment. If it's orange, do not leave a controlled environment. Try not to leave the house at all. And same thing if it's red. So oftentimes people that live in industrial places and cities are they stay in the orange. The last time that I think we've been in the orange here in Burlington was when they had the wildfires a few years ago, and the smoke blew into town. And so even from the wildfires out in the mountains. And so with that, you are going to get a little bit of air quality issues there. And they come from production companies, automobiles, trucks, large industries, gas stations, lawn and construction equipment, paints and cleaners. And if you're walking around the neighborhood, you'll even notice that if somebody had their house painted recently, or you notice a big construction vehicle goes by, or a big diesel engine goes by, you can smell and you can tell the difference. And that's kind of what we're talking about there. And then the other one is, like we talked about earlier, is that cold weather. So going out into the cold weather causes those blood vessels in your lungs to contract and kind of constrict and hold into that blood. And oftentimes it can also cause bronchiospasms, which is a spasm in your bronchioles because of the cold air. So that's why it's so important that when you go outside in the cold air, we want you to wear something around your face. So like the mask we're wearing nowadays. So it's a little muff that gives you a pocket of warm air so that you're breathing in warmer air than the colder air. So we really don't want you guys to breathe in that cold air. All right, well, that is it for today. Next time we'll be talking about how to combat these triggers and exacerbations and how to prevent them in coming forward. Thank you and have a great day.